what's your situation?
Please help me. My wife is having a baby. I need an ambulance now.
Sorry, sir, we don't have any ambulance in your area. You need to get yourself to the nearest hospital on your own. We are very sorry, sir.
Okay, I take her on my bike.
Good evening and welcome to the Maternal Health Channel. Tonight, we continue our mini-series on women's lives and maternal health. This is a collaboration between the Maternal Health Channel and the African Women's Development Fund, the African-wide grant-making foundation that supports women to make transformational choices through the provision of technical and financial resources. Tonight, we travel to the famous fishing village of Anomabo in the central region of Ghana, where we meet 19-year-old Emisa. She has just delivered a bouncing baby boy. Let's take a look.
Anomabo in the central region of Ghana is an old coastal town steeped in the country's history. It thrives mostly on the local fishing industry. On a quiet local street is a greenhouse where Linda Emisa lives. Linda has not been out of that door since she gave birth to a bouncing baby girl a week ago. She has stayed indoors throughout the day and throughout the night, ensuring that she does not break a cultural taboo she strongly feels to keep. For such an active person, the hours are long and lonely for Linda and her baby. Today, she is happy that Ajwa, an old friend, is visiting. Ajwa is also pregnant and expecting her baby soon.
Menya wenya semsisia.
We are not a family plan lady.
Na meshe. So baba. Maga ke
Bobosu.
Ebe was papa de musu was. Was e wona enya 1 week empwe. But reason why I'm putting there, we want him boa ipwe na se inhwa. Entum sansom ba fa oba na back. Baba na bana is time there is no need there. The more 1 week in on senior, it will pay pardon until that chana 1 week in and son.
When you 1 week in the soap, yeah. Eh, Biana, or you are walking to one be. When you in a pay. Why no, I the bush half a name of wine after a new. But we saw a wine no person. I'll get a soon, papa, to say, or this show, eh, be able for the night, another what the one pay. Why not the Alabama, a crown, Abia, or one your 1 week, in Puyana them for no crabba, and for her tapari. Or a woman be a minimum or cruma, also a kaji, a drubino one in him. Into say, near 1 weakness of prettiness or when you in a pay. Nay, it's quite a friend in my wine up for new. Until our day is still 1 week. So 1 week in the back, you two pay 1 week now, but I say, you pay us so pretender. By your on quite be a spiritual. That's so one, and to my BBC.
Ma woni ntimo ntumo mpo enua mo. Nti my sister no we take in charge on you. Nti me be share inside No be no si. She sister nana. The time you for you were begina. Of memo do fi one waba besin. Na me say na the time you di in your time. What another what to be will be one. Them time your boy she 18 hadi. I'm them time I be she dem into no super me man cash in punch.
What's the bill has spirits no ojutun there? Obiawo wa hanti ombra. The spirits no badamna so orokwa. Ono nama odu baby ayimpa na awo na. Ba miss obon before 1 week na say epede ko hospital another ko baby dem na say nyobi obokọ na wankasa bokoda. What's the tomb is below is so below na da ai wonyim na da ntuma hata kutido ama we hu umuma so na da ntuma itwa ha wa de nevi ai etum akọ nyanda mo so a kire e bia ekwa ahomachi e bia say aha na wa botum ka da ebesia fast na na akosheka am na etu fast na aba.
At night, with Ajua gone, Linda is again left alone with her thoughts and her baby.
Papa, no must say 1 year. Minya 4 months now, no, the 300,000. Also, moving was a bed. One face can baby, 9 months, I'm doing to only miss a midi, only miss a mono. And there is no need to make them as no mammy and another look on a fat than a neighbor's him. I've been to my catch and paying for them, but I don't know to my mammy.
Soon the week is over. Linda's mother proudly prepares the baby for the outdooring. This is a special time for Linda to bring out her baby and symbolically introduce her to the world. Linda steps out in white, having completed her confinement. It is a very significant, albeit emotional event for Linda and her baby.
Good evening and welcome to the Maternal Health Channel. With us this evening is Dr. Sylvia Diganos, an obstetrician gynecologist with the Tema General Hospital, who is going to help us to explore the issue of cultural beliefs in maternal health. Doc, what are your views about what we just saw in the documentary?
It's a very sad and interesting documentary, very revealing. It's a story of this very young lady, 19 years old, who has so many challenges. She has a baby. She has issues of poor social support. Her partner has not been very supportive. She's living in great fear that some evil forces will affect and cause her harm if she should step out and breach the traditional laws of venturing out of her home. So she's trapped in her room for almost a week. This is the time you need the most support you can get when you've had a baby. So it's really a revealing story.
What are some of the support systems that she needs at that time?
Pregnancy itself is a very challenging time for a woman. Right from the minute you get pregnant, you know your body undergoes so many changes. Even your appetite changes, the kind of food you change, your walking changes. So pregnancy is really changing you. Emotionally, you also changed. You have fears, you have anxieties. So the support really should start from the minute you get pregnant.
Okay.
And who is best to do that? The person you got pregnant with first and foremost. And then the extended family at large. And of course, this support must continue right through to the pregnancy up to the time you deliver. And delivery perhaps is the most challenging time in that pregnancy or the story of the pregnancy. We all, as women, have very strong apprehensions, having heard what happens to other women. So the labor and delivery time is challenging. We know that most of the very severe complications that threaten a woman's life occur around the time of delivery. So your support is even more crucial then. But then after the baby comes, is also new challenges that come. You now have somebody wholly dependent on you. And if you're a new mother like this young girl, you need help, somebody to help you walk that journey, care for this new baby, vulnerable, that you need. So the support is even needed more critically at that point until you begin to know how to deal with it. So support throughout pregnancy is essential all throughout. And like I said, especially at this time, when this new mother who doesn't know how to handle a baby, doesn't even recognize the problems that occur around that time. So the first week is particularly critical.
Okay.
And that's the time she needs all of us, from her support persons at home right through to the health personnel that deliver the baby.
So that tells me that being confined in such a small room for one whole week must be very, very stressful. What are the implications first for the mother and then for the baby?
Well, we must ask ourselves the first question: why have we chosen to impose these traditions on ourselves? And I think if we look back in our history and our tradition, I think our traditionalists did it for a good reason.
Okay.
Indeed, most deaths occur in the first week of life, especially for the baby. That scientifically is not challenged. All the data show that if babies will die, they tend to die within the very first week of life.
Okay.
So I'm sure our cultures have also recognized this challenge and have tried to protect the child by keeping it away from everything that they think could harm the baby.
Okay.
And so keeping the child isolated with the mother, providing 24-hour care and surveillance is perhaps what they think was the solution. And
Okay.
maybe they recognize that children are susceptible to infections when a whole host of people come into the home. So
Okay.
they keep people away. So that must have some reason why they have, developed these traditions. And I think it's almost universal in the country.
But does that justify keeping the young woman in the room for one whole week?
I think that it's been mostly the babies. From what I know of most traditions, the mothers tend to come out a bit to perform the usual chores. So in this particular case, it's a little more extreme in that the mother herself has also been confined. But when we listen to her story, she tells a story of being afraid. They're even suspecting there's somebody in the neighborhood who has an evil eye. And if she sees you, then you are gone. Your baby is gone. The baby dies. So I believe it's more than just the tradition. And she's talking about evil spirits. They are talking about putting a cross on your forehead with, is it blue?
Charcoal.
Charcoal. And that smacks of a bit of the Christianity faith of, if you look at the Bible, the biblical story of protecting yourself against the evil forces. So I think there's been a bit of the biblical influences or the spiritual church influence that has aggravated this particular story. So she's afraid. She's scared to death, and that's why she has not stepped out.
What are the implications for the health of the mother?
There are many implications for the health of the mother and for her baby as well. Let's look at the mother. I did say that all the severe complications associated with childbirth tend to occur around the time of childbirth and the first few days after that. So if she's bled if she bled heavily during the delivery, then she's at risk for anemia. She's even at risk for continuing bleeding. If she had what we call severe preeclampsia, which is blood pressure challenges, this first few days after delivery is not going to go away. It's going to be there. And she needs emotional support. Breastfeeding, how is she going to learn to breastfeed her baby and do it the correct way? So there are many implications for her own health and for even how she handles the baby psychologically.
And what about the baby?
Babies too tend to have a lot of new problems that may arise from how the delivery occurred. They may be faced with having had some injuries during the delivery, and somebody needs to check the baby out. Babies also tend to be a little less mature, and they may have jaundice because their livers are not ready to cope with living on
Okay.
Earth. So they tend to have little problems like jaundice. They may have breathing problems. They may get infected, and all these danger signs may be missed because she's not been able to take the baby
Okay.
to a health provider, or nobody has come
Okay.
in to look after
Okay.
the child. So
Okay.
definitely
Okay.
there are implications.
Are there any benefits for a new mother to be coming out, into the sun, the fresh air, the family, the community sitting around?
Oh, I think that for her in particular, the baby, maybe it's a good practice to keep the baby a little more confined and not expose the baby to the whole world, at that, because the baby's immune status, it's a little weaker in fighting infection.
Okay.
So I do support the need to keep the baby, but somebody must also check on the baby to be sure the baby is well all the time. But for the mother, coming out, talking to people, performing the chores, like even doing her little laundries and hanging things, talking with friends, it's definitely going to be more emotionally beneficial.
Okay.
And she too needs to see a health worker to be sure that she's doing well.
Okay.
Everything is going back to normal.
Okay. So as a health system, how do we work with the community to support people like this young lady?
Yes, you said it right. We must work with the community. I have always said that we as health systems, we support the community. We support you to maintain your health, because your health is your priority first. So we need to work with the community to make sure that we support them to provide care. There are so many approaches we could use. One I've mentioned, visiting the girl in her home. So we could have a health care system where we have assigned persons to visit the girl. But beyond that, we need to also find out why these strong traditions and what can we do to make things work for both communities. So we can work with the traditional leaders, even the churches in that district. Because in this case, particularly, she's talking about a cross. So could we go in and take away the evil eye that is walking around? Could we do purification rites to reassure the society and the community that the evil eye does not exist or has been overpowered, So the belief systems come in. Could we explain to the community the rationale, the reasons why they must allow women to come for healthcare? And I think we can work around these belief systems and work with our communities to make things better.
Thank you very much, Doc. But I want to find out, as a health system or the ministry, what kinds of mechanisms or what kinds of initiatives do you have for young women such as this young lady?
For young girls, we try to identify them at the antenatal clinic. And in fact, sometimes in some of our clinics, we do separate them. Because even coming to the antenatal center to say I'm pregnant, if you're a teenager and you have to sit amongst old women, everybody is looking at you with a different eye. What are you doing here, small girl? So sometimes they don't even come because of that. And they have many challenges. For most of them, their pregnancies were not planned. Some even the result of sexual assault. So they need special care. So we need to identify them, make them comfortable, and sometimes refer them for additional counseling. So the system does try to do that. Bring on board support persons to be with them. Sometimes we have to talk to the parents. So we do counsel the young girl and her support person, devote more time to educating her. She needs more attention. So counseling, strengthening the system, we do. We may not be perfect in identifying these people. And then we link them up to the community health care system. In Greater Accra, we have a Promise Network where we try to hand these particular girls to the community health nurses to follow them up. So there's something on the ground ongoing to link them up and support them.
I'm also curious to know how you are dealing with youth-friendly services.
Oh yes, we have adolescent health reproductive health services as well. But the aim is even to prevent this situation.
Okay.
Unfortunately, most of the centers are located in the hospitals. We have adolescent health centers, but you and I know that the youth don't like to go to hospital. So we have to find a way of reaching the youth in places outside of the health system. And very often we have programs with the schools to reach some of the young people outside. And when we have teenagers like this, we also refer them, because you don't want them to come back pregnant with a consolation pregnancy. You know, after the baby is gone and they need support, then they go back to where they got the first support, come back with a second pregnancy. So we do refer them to these centers for additional support and counseling. But we need to do more for the out-of-school youth who are difficult to reach. So there are still challenges with that.
In terms of our cultural beliefs and traditions that impinge on the health of women's maternal health, what are your thoughts? How do you think we can, you know, even if we can't eliminate it, how can we lessen it?
Oh, in terms of traditional beliefs, there are so many, I can tell you. I mean, this is just one of them. From even what kinds of food you should eat. You know, in some cultures, there are certain foods that are banned during pregnancy. So we need to, and pregnant women need the best diet. So we start from those areas. There are beliefs about where to deliver, who must deliver you. I remember in Tema where we were having challenges with some of the churches, because beliefs are not just traditional, it's also